Coming up, we'll be on location at DC Pearl's Dental Boutique in Washington, D.C., discussing the latest advances in dentistry, along with the benefits of dentistry and how they can give you the beautiful smile that you've always desired and improve your dental health with one of this region's top dentists, Dr. Quresh Ardakani. Dr. Ardakani received his DDS degree from NYU College of Dentistry and has completed his fellowship from the prestigious California Implant Institute. Dr. Ardakani is widely recognized as one of this area's leading dentists. Welcome, Dr. Ardakani. It's a pleasure having you on our program.
Thank you very much.
It's your first time, in fact, on the Top Doctors interviews. We have a lot to talk about, and I wanted to begin, if I may, Doctor, by having you please tell us about some of the advances that have taken place in dentistry and how they're benefiting so many more patients.
Some of the latest advances in dentistry, it would be digital x-rays that kind of allows us as a dentist to take an x-ray immediately, and we can actually discuss the x-rays immediately in front of the patient with them and show them what we see. Intraoral cameras are a big thing. We use intraoral camera on all of our patients, so they pretty much see what I see. Sometimes when we take x-rays, if the cavities or some of the other things are at the early stages of them, they don't show up on the x-ray. So we actually get to show them what I see and tell them this is where the problem is actually starting. In terms of cosmetic, veneers have come a long way. We have a lot of different types of veneers at this point. We can even do prepless veneers, depending on the patient, and the severity of the problem. We can do, in that case, we don't even have to prep the tooth. We don't even have to grind their teeth down. We can actually, take an impression of it, and the lab would be able to fabricate a beautiful porcelain veneers for them, so we can change their smile immediately. Another advance in dentistry that recently is become a trend is laser dentistry. There are a couple of different types of lasers. There's diode laser and there's CO2 laser. CO2 laser is more for hard tissue, cutting bone and things like that. We use soft tissue lasers here in our office, so we can contour the gum the way we want it. Sometimes, patients, they require, if they need some sort of aesthetic treatment, sometimes they require some manipulation of their gum. We can easily do that with laser. There is no bleeding, no pain. Some of the lesions in the mouth, like fibroma, if they have, sometimes they have aphthous ulcer, like canker sore and things like that, laser can definitely help with that as well.
Oh, that's very interesting. So it sounds like through the advances in technology, there are great benefits now for the patients, whether it be in the digital x-ray component, the intraoral camera where you and the patient can look at the same time more precisely to see what's going on, and also the laser technology that has advanced in recent years, as you just mentioned, really are getting some great results, and as a result, I would think great benefits for your patients.
Definitely less pain, faster results.
And as far as on the cosmetic side, what are some of the more popular treatments that your folks are looking for?
If people require cosmetic treatment, and they ask for it, sometimes it's direct or indirect bonding. Direct bonding, which would be white fillings, composite fillings. If the damage to the tooth is a little bit more severe, they might require all porcelain crowns, which the results are beautiful and long lasting. If there isn't a lot of damage and they actually just want to have a cosmetic treatment, they just want to change their smile, porcelain veneers are a great treatment for them. As far as crowding and malocclusion goes, sometimes people have crowding in the front. A lot of people actually do have crowdings and spacing in the front, and Invisalign or orthodontic treatments can definitely help with that, orthodontic intervention.
And what type of results are your patients experiencing from
the results are pretty good, long lasting, and patients usually love them. Especially, we don't do any silver fillings, or as also amalgam restoration, as they're known, silver fillings. We don't do any of those. We only do direct bonding, which is tooth colored fillings. So they love them. They last a long time as long as they keep their, kind of appointment, their 6-month appointment. They come in and they have good oral hygiene. They should last them a very long time. All porcelain crowns, they're very good and they last a very long time. Again, everything kind of depends on patients' oral hygiene and how often they keep up with their appointments and their maintenance, but the results are usually very good.
And you also have a unique approach that you all offer here at your practice, in the sense that when the patient or potential patient at that time contacts your practice, you really go through a comprehensive exam and process and meeting to really understand each of your patient's specific needs, and you customize treatment plans for each one. It's not off-the-shelf type of stuff, if I may use that phrase. It's really looking at each individual and seeing how best you can help them.
I mean, a lot of offices don't have that approach. We see one patient at a time. There is no double booking, so every patient gets an allocated time. So we spend the time and energy, and we answer all of their questions, make sure they get the attention that they need. Answer all of their questions and all of their concerns. And one of the things that I really enjoy doing is educating patients. So when they come in, and by the time they leave, if they have any problems, I want to make sure they know what is the problem, how I'm going to help them, and what are the possible alternative treatments, if there is anything we can do differently for them, if they have any concerns, if they want things done differently, and if that's possible to do, we'll definitely try to help them out and accommodate them. By the time they leave our office, all of their answers are pretty much all of their questions are pretty much answers.
Yes, indeed. And as far as follow-up visits, I think you mentioned it a few moments ago. You generally recommend your patients to come in once every 6 months, just for a checkup?
Well, it depends on the type of type of problem and this type of problem they have. If it's like a basically like a normal patient, and they just have like a cavity here and there, and they don't need a lot of treatment, they don't have gum disease, we usually recommend every 6 months. If they have gum disease, depending on the severity, once they get the treatment done and the treatment and the condition is under control, we recommend every 3 months.
Now we're literally out of time, Dr. Ardakani, but I wanted to ask you, before I let you go, you and your practice, DC Pearls Dental Boutique here in Washington, D.C., I mean, you're right here in Georgetown, convenient to Northern Virginia, Montgomery County, Prince George's County, the whole area. Great location to help serve the patients' needs from throughout the region. You've really established a reputation for excellence, not only as one of this area's leading dentists, but also, as we just touched on a few minutes ago, where you told us about the process and the great detail and the time and individual attention you give to each of your patients to help them with their needs. Is there anything else you would like to add for our viewers?
We have a great team here, and we take great pride in providing the best care for our patients here. In our practice, we try to stay up to date with the latest technology. As I mentioned, intraoral cameras, laser, we got panoramic x-rays, we got digital radiography with very minimal radiation here. And personally, I take great pride in my profession. I love what I do, and I try to kind of excel every day. I try to find what is the next big thing, and I continuously go to continuing education courses, to conferences and meetings, and try to make myself better, because then I can serve my patients better.
Absolutely, and you all not only help folks with general dentistry needs, cosmetic dentistry needs, as you mentioned earlier as well, plus implants and Invisalign. And we'd love to do, Dr. Ardakani, is first of all, we want to thank you for joining us here today and being our guest on our program and educating us. And also, we'd love to have you back on in the future and talk a little bit more specifically about implants and how they can help patients, and Invisalign for those busy professionals who could benefit from that, not to mention students as well. So on that note, we'd like to thank you again for joining us, being a guest on our program. It was our pleasure having you on, Doctor.
Thank you very much. Thanks for coming.
Thank you.
Appreciate it.